everybody, Sandy Sue here with my friend Josie and my friend Steven, and we're going to talk to you about malaria and what you need to know. Hey Josie, what's malaria?
It is a parasite that is spread by mosquitoes. It spreads to the liver and therefore infects the red blood cells.
There are 4 species that cause malaria: Plasmodium vivax,
Plasmodium ovale,
Plasmodium malariae,
and Plasmodium falciparum. Now we're going to go over the life cycle of the Plasmodium. There's one cycle, but it's different in both the mosquito and in the human. Let's go over what happens in the mosquito first. The mosquito is the definitive host, and the usual carrier is the Anopheles species. This mosquito bites an infected individual and acquires Plasmodium gametocytes in the blood. They're usually female, and then the gametocytes develop and fuse into the mosquito's digestive tract to form a zygote. This is where fertilization occurs. The zygote then undergoes development to form an oocyte. Sporozoites develop in this oocyte. Thousands of sporozoites emerge from the oocyte and invade the salivary gland. As they're released, the Plasmodium sporozoites are transferred to the mosquito's saliva, and that is where it is transferred to the human host if the individual is bitten. Now let's see what happens in the human. A female Anopheles mosquito carrying malaria-causing parasites feeds on a human and injects the parasites in the form of sporozoites into the bloodstream. The sporozoites then travel to the liver and invade liver cells. Over 5 to 16 days, the sporozoites grow, divide, and produce tens of thousands of haploid forms called merozoites per liver cell. Some malaria parasite species remain dormant for extended periods in the liver, causing relapses weeks or months later. The merozoites exit the liver cells and re-enter the bloodstream, beginning a cycle of invasion of red blood cells, asexual replication, and release of newly formed merozoites from the red blood cells repeatedly over 1 to 3 days. This multiplication can result in thousands of parasite-infected cells in the host bloodstream, leading to illness and complications of malaria that can last for months if not treated. Some of the merozoite-infected blood cells leave the cycle of asexual multiplication. Instead of replication, the merozoites in these cells develop into sexual forms of the parasite called male and female gametocytes that circulate in the bloodstream, and then the cycle continues.
There's an incubation period of 10 to 15 days before you see signs and symptoms like a fever,
Nausea, tiredness,
loss of appetite,
abdominal cramps,
myalgia,
cough,
diarrhea,
slight jaundice, orthostatic hypotension,
and to diagnose malaria, we must use diagnostic tests such as a blood smear, in which we would smear the slide with a GM cystine. Therefore, we can see the parasites within the red blood cells.
We can also use the rapid diagnostic tests and the polymerase chain reaction tests.
However, we cannot just use symptoms to diagnose because they mimic other diseases such as yellow fever, dengue fever, typhoid fever, cholera, and more.
Now we're going to look at the effects of malaria. The effects on children are if they are living or traveling to malaria risk areas, they will be affected. They need to take anti-malarial drugs.
On pregnant women, if they are affected by malaria, it can create problems such as prematurity, abortion, or stillbirth. They have to avoid taking specific drugs due to their pregnancy.
If an individual has Plasmodium falciparum, that individual needs immediate attention.
If treatment is delayed, that person could die. A mild case requires oral medication,
And a severe case requires IV drug treatment and fluids in a hospital.
in a normal case, the drug of choice is
Chloroquine phosphate.
However, some Plasmodium strains can become resistant.
Therefore, multiple drug treatments are used. An example would be quinine sulfate and doxycycline or tetracycline.
A doctor can usually recognize which strain caused the malaria infection due to the country they were infested at. Overseas to a malaria-infested place, you should be taking anti-malarial drugs. Like so.
While you're in malaria-infested countries, traveling or there for missions or whatever, you'll want to wear long sleeves or to cover any exposed skin. And then also when you're sleeping, you'll want to sleep with a net around you, and that'll keep the mosquitoes away while you're asleep. What better way to prevent mosquitoes than off repellent? Not oily or greasy, but smooth and dry.
And when you come back from your trip from a malaria-infested area, you should continue to take anti-malarial drugs. Well guys, thanks for watching and learning about the #1 most common disease in the world.
How great thou art, how great thou art. Then sings my soul, my Savior God, to thee. How great thou art, how great